8:30 on the button. And that means time to talk to the doc, or today it's Talk to the Docs, as we welcome in Dr. Tim McKnight from Trinity Hospital, Twin City. And today, Dr. Mike Jakubowski from Twin City Chiropractic, again brought to you by Mako's Market and Pharmacy and Twin City Chiropractic. Good morning, gentlemen.
Good morning.
Thanks for coming in. We're keeping social distance here, by the way,
yeah, we're
too.
doing pretty good.
Everything's been disinfected. I guess we'll start with you, Tim, and how are things at the hospital? Things leveling off?
Status quo. We're seeing more patients are starting to come into the hospital for their normal visits, but just a lot of people are still afraid. They're still staying socially isolated, which is a good thing. And from what I'm seeing, we're not seeing anything escalating here in this area.
Mm-hmm. And like you say, some people are afraid. I kind of was hesitant, I guess, at first, but my wife had to come in for some blood work, and I brought her down and walked in with her, and I was stopped at the door. The lady with the mask on at the desk asked my purpose, and when she found out I was just with my wife, I was not allowed to go in. So, I mean, it's a good thing. Everything is being done correctly, and you're not just, letting people go anywhere, anytime.
Yeah, right. We're taking all the precautions that has been recommended. So it's a little different when you come in the main entrance. Somebody's there to check your temperature and ask you some questions. Mm-hmm. For the staff, we have the same thing. We have our temperatures taken when we enter and when we leave for the day, and of course we're wearing our masks when we're interacting with patients.
Sure.
So it's a different feel, mm-hmm. but we're starting to get used to it,
and we're starting to flatten the curve from what
I think so. I think the fears that I initially had have been dispelled a little bit, and it's not quite the same feel or concern that I had initially. So of course we're not in one of those hotbed areas where we're seeing a lot of very sick patients. Right. And I try not to forget that people have died, people are suffering, and families are saying goodbye to loved ones without really being at their side, and that's got to be horrific.
Incredible, yeah. I mean, it's just a whole new world in the past month or so. It's hard to believe. I think that's what's hard to wrap your head around, that things change so quickly. From where we were, say, in February to where we are now in April. It seems like a different planet.
Yeah, it does. But I'll tell you, our medical staff and our hospital has really responded well, as have all the hospitals.
I agree with that.
And we've continually updated our responses and the things we're doing in the hospital to protect ourselves and the patients. So mm-hmm. it's an evolving process. Right. It's changing every day. But just the leadership that we're seeing at every level is really something special to be part of.
That's well said. Dr. Jakubowski, how about Twin City Chiropractic? How are things evolving and changing for your business?
Sure. Obviously, things are a lot slower for our office, too. Mm-hmm. Again, people scared. But in our office, too, we're following all regulations. Same thing. If you come in with somebody that's, just there with the patient, they're not allowed in the building.
Right.
And we try to separate all that, spacing out appointments so people aren't interacting or even seeing each other in the office. So
for the two of you guys, you were workout friends. You guys would go to the gym all the time and do your workouts. How's life changed as far as like getting your exercise routines in?
It's definitely different. It's hard to not be able to do the things we're used to doing.
Push each other, that type of thing.
Yeah.
So, yeah. But I'm reading a lot about people, how they're evolving and figuring out how to do it at home. And, I always go back to the old Jack LaLanne method where you could take a chair and turn it into an exercise machine. I mean, everything is possible. But you just have to get creative, I guess.
Right. I think that's the good thing about technology now. I mean, you can go on YouTube and look up exercises to just do at home. The problem is self-motivating.
Yeah, that's a good point.
That's what you miss is a good workout partner that helps motivate you to actually get out and do things.
Hopefully in the next few weeks we'll be able to get back to seeing people again and doing things like working out, which is so important. I want to talk about something, Dr. J, you guys offer at Twin City Chiropractic, active release therapy. This is something that not every chiropractor is doing. Can you tell our listeners a little bit more about active release therapy?
Sure. Active release therapy or technique is basically a deep tissue therapy, and basically what that means is not a massage, but a different way of attacking muscle injuries. So what we see in practice and what people experience every day is what we call a cumulative trauma disorder or repetitive motion. Is that working at a factory pulling a lever, someone that changes or is a mechanic and uses the same muscles day in and day out. And we see this with people that just sit at a computer or a desk. They're using the same muscles. Well, trauma develops through time. The muscles break down or tear down, like an injury if you sprain your ankle or trip or fall, and scar tissue develops in the muscle fibers. And when we see that, we see altered function develop in the body. And when that dysfunction develops, we have pain that's generated. So it's this cumulative trauma that develops and mechanics are altered. And our goal is, okay, we can fix this scar tissue by putting the muscle through its range of motion while we stretch it.
Gotcha.
So it's active. And when we do that, we break down scar tissue, we allow proper blood flow to the muscles, and healing can develop.
Probably one of the most common things you hear about for people, and you mentioned like repetitive work, would be carpal tunnel with the wrist. Is
exactly.
Would this be helpful for that?
This is a active release technique, does great for that. Tennis elbow, epicondylitis, where you just have this pain in your elbow every time you go to grab that mouse and click it. Those type of things. That's where just overuse develops, scar tissue develops, and that's a way of stretching it and getting blood flow back to the muscle.
So anytime you're asked to go in and have a surgical procedure, wouldn't it be smarter to try something like this to see if you get this to help the issue as opposed to, say, going under the knife?
Sure. And Dr. McKnight and I talk about this all the time, is we can look at treatment in phases. Is before you take that most aggressive step is, what's most conservative?
Sure.
Okay, let's do some therapy.
Right.
What's more aggressive? How about we take some medicines, anti-inflammatories, or cortisone injections? And then after that, boy, this isn't working. Okay, let's refer you to a surgeon that maybe can help this out the best.
I'm all for trying the earlier plans as opposed to going in the operating room.
You know, I saw someone in the office yesterday who was having leg pain, just a throbbing pain going down the front of her thigh. And it started in her hip, and another provider suggested she get an MRI of her back. So I was seeing her yesterday just to do the examination and to do all the steps that I needed to get this MRI approved. And it seemed apparent to me that this was not coming from her spine. This is coming from a muscle in her buttocks called the piriformis muscle.
Okay.
And when that muscle gets tight and it gets thick, it pushes on the sciatic nerve, and she was having sciatic symptoms. And I said, you know, before we get the MRI and go down this path, I want you to see Dr. Jakubowski.
And try
so
to get
he
it
doesn't know
stretched
this
out.
yet, but she'll probably be in this week.
That's
and
great.
I tried to
That's
reassure her
great.
this type of therapy can be great. I've seen this work multiple times with patients that have seen Dr. J. So I'm excited to see what kind of results she has.
That's fantastic. I can't wait to hear an update and see if
Yeah.
this helps her out with that situation. Was that the Fit for Life session, which I missed the original time, about Coach Hartzell and the stretching with the bands? And it was just incredible watching this guy, almost 80 years old, pop up on this table, bounce up, stretch, and he brought some other people up who had some issues, and they used the bands, and they actually had better movement. Your thoughts, Dr. J, on the stretching and the bands?
Yeah, it's basically the same concept of chiropractic or active release technique. It's motion. And basically what he does with the bands is he creates motion inside joint tissue. So what we know is joints, if we look at the joints of the spine, the knee, the shoulder, they have poor blood supply. So the way nutrients and lubrication is put into the joints is by motion.
And if you're not using them, they're going to
dehydrate.
Yes.
Yeah, so synovial fluid rushes into the joint, feeds the joint tissue, and allows things to heal and move and lubricate. So the bands do that. They open up the joint, you're putting motion through there, and people feel good. That's what basic definition of osteoarthritis is. People say they get up in the morning and they're like, boy, I'm hurting so
move,
bad. I
yes.
can't get out of bed. But once I start moving in the morning, I feel better.
Bingo. It
So,
makes sense. It's obvious. And something so simple as, you don't have to have this $1 million machine to stretch out or to work out to. It can be as simple as a rubber stretch band. I mean, it doesn't get any easier than that.
Right. And sometimes, though, I think there is an order to how you progress through these type of injuries, because if you have a tight muscle, sometimes you have to have somebody put their hands on and do the active release treatment first, and then once you've restored the motion, then you maintain it with those stretches. But if you just start stretching,
Right.
and you can't get those knots out on your own, you need to see somebody that knows how to do that for you.
Perfect example, though, of what you're saying. This lady that came in yesterday, you understand, working alongside with Dr. J, before you send her to a surgeon, let's get her to Dr. J and see what he can do with it. And what a great,
he's taught me
team.
over the years, and I've been a patient, so I know what it feels like. I know how
Right.
it helps, and I'm sold on it. I think it makes perfect sense and is very effective.
I love it. Keep up the good work, and we're going to get back to some sort of a normal routine. I can feel you guys want to get there to that gym and work out again, and it's tough doing it on your own, like you say. The motivation factor is the key.
Yeah, that is the key. And like Dr. McKnight was saying, and one of our goals too is, after we get people feeling good, is, hey, you need to do these type of exercises. You have these bands. The hard part is using them. Actually use them.
Right. I think that's with any piece of equipment that you have. If it just sits there, it's not doing any good. You've got to get out there and use it. This time of year, get out, get some fresh air, walk, run. Perfect way to feel better.
And that's the thing, is even if it's, I mean, sometimes me and him, when we get together, it's, boy, we have 15 minutes to exercise.
Yeah.
Well, let's do 15 minutes, because
Yes.
it's better than nothing.
And nothing.
So
well done.
And it's not always fun. We do a lot in 15 minutes.
Yeah, and well, like you say, I mean, even something as simple as mowing the lawn or going up and down the stairs at home doing housework, that's considered exercise, and that's
Keeps your
important.
heart rate up, sure.
Absolutely. Dr. Tim McKnight from Trinity Hospital, Twin City, and Dr. Mike Jakubowski with Twin City Chiropractic. They're at 205 Grant Street in Denison, and you can give them a call at 922-2325 to if you have any questions or want to schedule an appointment. Appreciate the update. We'll see you again next month,
Yes,
and
sir.
hopefully you guys will be back in the gym by then.
yeah, that would be great.
And Tim, we'll see you next Tuesday.
Thank you. I'll be here.
Appreciate the advice as always. Great info from both Dr. McKnight and Dr. Jakubowski. Brought to us again by Twin City Chiropractic in Denison and Mako's Pharmacy in downtown Uricksville. We do it every Tuesday morning here on WBTC.